Still ahead on WJTV at noon, we're focused on back to school initiative around here. We'll hear from Dr. Timothy Quinn about sports physicals for high school athletes, why it is such an important thing to do. I'm joined by Dr. Timothy Quinn to offer his expertise. Now, Dr. Quinn, you have a lot of experience in this area, and you say a physical could perhaps save a child's life.
Oh, yes, and I wanted to share a patient that I saw a while back. Child came in, we did a physical, and we heard an abnormal heart sound. And we informed the mom we need to refer the child to a cardiologist before, resuming play on the field. Well, the mom, she was not having it. She went somewhere else and got a physical, and that provider did not catch the heart sound. Well, the deal is the child ended up about 3 weeks later in the emergency room. The child had fainted on the field. And in the emergency room, they heard the same heart sound. They did an echocardiogram, got the child with a cardiologist, but the child had a condition called hypertrophic cardiomyopathy. And this is a condition that's very dangerous. I mean, one of the possibilities with this condition is sudden death. So luckily, we were able to help that child by getting them out of the playing, but the deal is parents really need to listen to providers, and if they say the child needs to see a specialist, let's go ahead and see the specialist to save that child's life.
Absolutely. What are some of the things that should be checked for in every high school physical before that child takes the field?
Well, we providers, we do what's called the ABCs. We check the airway, the upper and lower respiratory tract, check for asthma. We check for heart, of course, different heart conditions. We do range of motions of the joints, check for scoliosis and vision and hearing and so on and so on. But the most important thing is it's a good idea for children to get physicals with the physician. I'm not a big fan of the group physicals where you have all the children in one room with maybe one or two providers, but just get a very detailed physical, because a lot of things that a child can have that are undiagnosed can actually be potentially be deadly.
Are there any questions that parents need to ask every time their child goes to a physical?
Well, the most important thing is be prepared, and if the child has anything going on like a history of asthma, a history of shortness of breath, or different aches and pains, let the doctor know, because the history is just as important as the physical, because it gives us information and it alerts us on things that we need to further investigate. So maybe at the beginning of the physical, go in the room with the patient and talk to the doctor, help the child, but then at the end, it's a good idea if the doctor can just talk to the child alone, because we also talk about other things like school performance and just things that the teenager might want to tell the doctor they might not want to let the parents hear about, so they can feel comfortable and we can help them.
So this could go beyond the athletic field to even classroom performance then?
Oh yes, I mean in our state it's not mandatory to get a physical, so we physicians and nurse practitioners and other providers, we take advantage, and when the child comes in for the physical, we make sure the child is safe, but we also assess for other conditions that could interfere with the child's ability to do well in school, such as ADHD and different learning disorders and so on and so on. So physicals are so important because not only can they save your child's life, but they can make it so that if the child has a problem that can interfere with their learning, it can be diagnosed and treated, and the child can have a fair chance at performing well in school.
That's absolutely perfect. So you're covering the whole child there, athletically and academically.
Oh yes,
One
very
simple
important.
physical.
Yes, sir.
Dr. Quinn, thank you so much. Quinn Family Medical out of Richland, Mississippi. We do thank you for taking the time here with us today.